Thank you very much. I appreciate the opportunity to come up and talk about the potential impacts from this new facility. And I stress the word new because currently there is not an existing facility at the site or adjacent to the site. And this is an important factor when we consider what the potential impacts are on this community. Let's go ahead and turn the next slide here. What I'd like to do is briefly talk about potential toxins that are released during the asphalt manufacturing process and the control technologies present at the site. Issues related to no health risk, potential odors, and then the impacts on Bay Area Air Quality Management District threshold levels. So if we go to the next slide, this is a generalized description. We had a very detailed description from Catherine about what the proposed process would be, what her technology would do. But in general, what we need to consider is that in an area which is essentially pristine in your community, you are now putting in a large polluter that is going to move lots of material around. In that material, you're going to have this aggregate and the other materials along with the chemicals. We know that these solid materials can be broken down and may become airborne. This is the particulate matter that we've all talked about frequently. So in this generalized scheme from US EPA, it talks about how the materials get mixed in, how the asphalt chemicals get mixed in, and how ultimately you produce it. From their assessment and Bay Area's assessment and the California Air Resource Board's assessment, there's clearly multiple sources of toxins and pollutants that will be released. If we go to the next slide, I'd like to talk a little bit more about those. The first one is particulate matter. What's particulate matter? That is dust. Dust comes in different sizes. Here's the very simple fact about dust. The smaller the particle, the farther into the lungs it goes. The farther into the lungs it goes, the more adverse health effects. So let's put that out there. US EPA recognized back in the 70s that particulate matter was an issue. They made particulate matter one of the criteria pollutants. There are multiple pollutants. Ozone is big one in Los Angeles, nitrogen oxide, oxides of sulfur, carbon monoxide, and particulate matter, along with lead, were the driving factors in designing our air quality systems out there. So each of these chemicals, pollutants, were identified because they had significant adverse health effects to either the environment or to humans. If we move on to the, I'm sorry, and this is, this little chart I have here is from US EPA on the generalized asphalt emission plant. Similar to this, before we talked about all this other technology that was involved here. But you can see that there are large quantities, whether it is fed by fuel oil or whether it's fed by natural gas. What is produced is potentially large quantities of these criteria pollutants. If we move to the next slide, you see that this is a list of polyaromatic hydrocarbons. This is that sooty, tarry material that we've become familiar with over the years. Potts was one of the first people to discover that PAHs, when applied to the skin, would ultimately produce a cancer. There's lots of scrotal cancer among the chimney sweeps in London. I'm not suggesting that's happening here, but it's the basis of our idea that PAHs are not very good for you. And the items that are listed in red are those compounds that are known to be carcinogenic to humans. The other ones still have adverse health effects. And one recently that changed, naphthalene, has been recognized by the state of California as being a human carcinogen, and I put that in the red there. Now, in addition to the PAHs, if we go to the next slide, there are volatiles that come off, hazardous air pollutants. And they're hazardous because they cause us some kind of effect. The ones in red, benzene and formaldehyde, are known human carcinogens. Ethylbenzene is being reevaluated by the state of California, and they're leaning towards making it a human carcinogen. If it's not a carcinogen, then it may act as a neurotoxin. If it doesn't act as a neurotoxin, then it is an irritant. High doses of these things may produce a giddiness that's you will read about in literature. This really depends on what the dose is, how much is coming out from an area and where it goes to. If we move to this last slide on this, there's also known to be metals associated with emissions from these type of operations. If we move on here, the next slide, let's talk about control technologies. Thank you for making the reference about the vacuum. Baghouse filters are great for picking up particles, but like a vacuum cleaner, it has to be checked and the bag has to be maintained. If the bag isn't maintained, the particle goes right through. Baghouse filters don't stop vapors. So if there are vapors entrained in the air that was going through the baghouse filter, that's not going to be stopped. Something like a carbon filter on the back side of that will work. I was discussing with someone earlier, if you're in a hazardous environment, when you walk in to do an industrial health survey, you don't walk in with a paper filter. You walk in with a respirator that's either got charcoal filters or supplied air. So having control technology in place is great. Making sure it is the appropriate technology and there's redundancy is even better. The goal, as been stated here, is that clean air comes out. So let's define what the clean air is. The clean air should be no hazardous chemicals coming out. The filter bed mister, knocking out the smoke, great idea, but again, the same comment. Will that remove the vapors, the volatile organics, which are going to be an issue? And then lastly, my comment is, what about the fugitive controls? We've got the trucks under negative pressure while they're there. What happens the moment they leave the facility? And just as importantly, what is happening to the trucks who are coming onto the site? If there's not an efficient way to get things in and out, what you've done is create another source of pollution adjacent to the facility, which is going to drive much of the risk here. So if we move on to the next one. The no health claim. Let's move on to the next slide after that. What I'm showing you here is the material safety data sheet that was provided by the proponents in their draft EIR. This came from Shell, the supplier, and what it says here is hazard identification. There's hydrogen sulfide in here, which is extremely flammable and may be present. Contact with hot materials is bad, but more importantly, down underneath it says, in applicators where vapors caused by high temperatures or mists are present or created, breathing may cause a mild reaction in the throat and lungs. So it's a warning to workers. An MSDS is supposed to be provided to workers to identify what their potential threats are. And it's a serious thing that goes on. If we go to the next one, so this is the short-term acute effects. The chronic effects, this is from the producer of this. It notes that it is carcinogenic in animals. So the materials have been identified as being a serious health threat there. So chronic exposure to this is going to cause a problem. Down on the bottom it says signs and symptoms. Lung damage. I should have worn my glasses, I'm sorry, I can't read from this angle over here. Scarring, bronchitis, emphysemal type of reaction. So here we've got the manufacturer saying, let's take a pause, guys, and look at what's going on here.